I would like to welcome you all here to this lecture about how public transport providers can increase vaccine access with our guest Stuart Mader. In this lecture, Stuart will follow the thesis that accelerating COVID-19 vaccination will advance a post-pandemic future in which transit can fully realize its promise. This session will highlight three ways that transit agencies can support vaccination for communities they serve and explain how accelerating vaccination will help agencies better prepare for post-pandemic service. Before I introduce to you our guests, there are some technical information. You might have heard them in lectures before, but just to make sure everyone knows how to use the tools, to use the chat. Stuart will give a lecture in a couple of minutes, and after that there will be time to ask questions or comment. You are welcome to do this, and you can do this here via the chat. So you can't speak out loud, but you have to use the chat. And this is very important. Make sure that it's not the global chat. The global chat is the one that everyone here at the conference can see and use at all times. But make sure that the chat that you're using is only the one for this session here. And you can find this above your screen. There should be a little tab called Chat Zuschauer, which is right next to the tab that says Stream. So make sure you use this chat, and you can type in your questions and comments there, and I will read them out loud so Stuart can answer to them. All right, so I am very pleased to welcome Stuart here. And Stuart Mader studied chemistry at the University of Hartford and completed his Master of Education at the University at Albany, New York. And since then, he's committed to develop equitable and sustainable mobility structures through numerous projects and a great deal of dedication. Along the way, Stuart has led customer advocacy for New Jersey Transit, the third largest provider of bus, rail, and light rail transit by ridership in the United States. He has written his book Wiki Patterns and worked with numerous political and business leaders. We are very pleased to welcome you here, Stuart, and I hand it over to you now.
Marie, thank you so much. I'm so glad to be here with everyone. I thank you for that wonderful introduction and for such a great conference. There's so much good conversation happening right now about how we reshape and how we rethink transit in the new world in which we live. COVID has changed so many things. It has been in some ways a very sad time, but also I always try to look for the silver linings in things. And excuse me, to me, the biggest silver lining for transportation is some of the biggest problems we faced in 2019 before the pandemic are no longer the major problems we face, and we have new opportunities to rethink and represent transit to people in new ways. And part of what we benefit from is this new recognition of transit's importance, and that's something that I look at that in the U.S. in America, public transit has for much of the last 50 years been seen as secondary to driving and roads, and much of that came from the perception after the middle of the century, after World War II time frame, kind of in that time. There was such a growth in driving and such a growth in the idea of highways and traveling on sometimes they call it the American open roads, that we forgot about how important transit is in some ways culturally. We let it be less important. And we're now realizing that for so many reasons, it is very important. It never really lost that importance, and we need to get back to thinking of it that way. It's important for economic development. We know that places that are transit dependent, transit built around transit, have better economic productivity. They're better resilient to changes in the economies. They provide people better access to jobs and opportunities. Transit also is very important for the climate resilience and the environment. Places that are built around transit protect the environment. They allow us to build in ways that preserve the environment, reduce pollution, give people healthier quality of life. When you're not always dependent on a car to go places, there are some such big benefits to that. And there are also important health benefits to transit. When you live a lifestyle that's built around transit, you are generally able to walk more, to have more access to green space, more access to active transportation and lifestyle, and that's healthier. And as we've learned with COVID, there's another element, there is another layer to that health, which is um, transit is one of the most important ways to get people vaccinated, to get people protected from COVID and get them to what I would call the new normal, the world in which we're going to live after we're able to move beyond lockdowns and restrictions and things of that sort. And it's also important from that aspect because much of the early messaging around transit was so focused on the idea that you shouldn't take transit because you might get the disease. This idea of the vector for viral transmission, you might call it. We now know from studies around the world that that's not true. There is not a single outbreak of COVID anywhere around the world that has been directly tied to public transit. And that's important because transit is not the way people ride on transit. It turns out to be not the way that puts them at highest risk for spread of the virus. Being in, for instance, an office building for 8 hours a day with poor ventilation is a much higher risk than being on a bus or train for 15 or 20 minutes with a mask on, with not talking, just to not worry of spreading things, and also being on a bus or train that has, as many transit systems have done, improved ventilation, made sure that people can open windows, and made sure to very strictly message to people the requirements of wearing a mask and maintaining limited capacities and all these things that make transit safer. So for all those reasons, transit is a safe place to be. And the best way that we can reinforce that to people is, and underscore that to people, is for transit to play a central role in getting people to the vaccines. Getting vaccinated is going to be the thing that makes sure that people don't get sick. It's going to reduce the risk that people die, that we have this terrible impact on our communities. And it's also going to be the thing that reconnects us back to each other in such important social ways and ways that we need to have in our communities. And so I have been, for much of the last several months, starting last December, I have been working with transit agencies around the US, the United States, Canada, and some in Europe too, to advance this idea that every transit agency should be involved in transporting people to the vaccine, making sure that they have access. And what I want to share with you are the 4 steps to doing that I've been working with agencies on, and some of the things agencies are learning along the way as they're doing this, so that we can spread this further around the world. And I'm very interested to hear your questions and help you in any way I can if you're in a position where you can advocate for this or you can help people decide to make this happen. One of the important things to start with on that is the question of equity and making sure that we're distributing the vaccine in a way that's fair to everybody. That's something that's been a challenge in America. We've seen now data on distribution of the vaccines where we're seeing that white Americans are getting vaccinated at higher rates than Latino Americans, Black Americans. In fact, some recent data shows that white Americans have been getting vaccinated at 3 times the rate of Hispanic Americans and twice the rate of Black Americans. That's not good. We want to make sure that people are getting vaccinated, that there aren't disadvantages in how quickly people are getting vaccinated, and that any one group isn't being left behind. Because when we look at some of those groups that are behind in the rate of vaccination, they're also groups that are traditionally, so to speak, or have not always had the best, been given the best access to healthcare, to things that are important in terms of economic and social and health opportunity. And so vaccination is an opportunity to fix that, but it's also important to make sure that we do that in a way that really works. And that's where transit comes in, because many of the communities that, in looking at the data, particularly in the US, that have been behind in getting vaccinated are communities that tend to be more reliant on public transportation. It's also a factor of decision making. Some of the vaccination facilities that have been opened up initially were very focused on driving, drive up, drive through. You've seen these pictures, I'm sure, of sports facilities with long lines of cars lined up on giant parking lots waiting to get vaccines. And that decision came from early in the pandemic, the idea that It goes back to that idea, that message that was spread early on, that public transit wasn't, we weren't sure if public transit was safe. We were culturally discouraging people from being in shared spaces, and that applied to public transit. And so that created a feeling that being in your car was safe, and therefore setting up testing sites, using large sports facilities, large parking lots, and driving up to get tested was what we saw early on. That directly contributed to the decision to make vaccination sites drive up as well. We see these patterns, these kind of in decision making. And I bring that up not to say that anyone in making those decisions was necessarily wrong. People make decisions with the best information they have. But now, as we have better information, we know that transit isn't a vector for spreading the virus. So we can use transit to move more people, to get more people to the vaccine and make sure that they're safe. So there are four steps to do this. I know that I want to start with the very first one, which is vaccinating transit workers. Every transit agency that's going to help move their community to get the vaccine, the very first step is to get their own transit workers vaccinated. That's important because the bus drivers, train operators, light rail operators, ferry captains, anyone who is operating transit and is in contact with the customers, with the public, needs to be vaccinated first and deserves to be vaccinated first. They're in jobs that require them to be in contact with the public, and that puts them at higher potential risk of getting COVID-19. So vaccinating them first enables every agency to say, our own staff are protected. That's important for them. And it's also important for customers to be able to say, you're getting on a vehicle to go get your vaccine, and you can feel confident that the person driving your vehicle is vaccinated. And you can also feel good about that decision, that decision was made to protect them. So that's the first one. Second one is to host vaccination sites at transit hubs. The core value, the core structure of public transit is to connect us with our communities. And much of that connection happens through hubs in transit systems, major railway stations, large bus terminals. These facilities naturally they're bringing people together. And so they're natural locations to put vaccination facilities. And I've been sharing on my website and on my social media, particularly on Twitter, examples of this happening around the US, Canada. I'm beginning to see examples in Europe that I'm sharing. And just this week, I shared an example of an agency in Akron, Ohio, which is in the US Midwest, that used its bus storage facility, so garage where they park and maintain their buses. They turned it into a vaccination site, and they vaccinated 500 people just this past Thursday by bringing them to that site on buses, getting them vaccinated, and then giving them a ride back home. In California, in Los Angeles region, there is a transit company called Foothill Transit. They serve a town called West Covina, California. The hub of their system is called the Covina Transit Center. And they turned that transit center into what they call the Covina COVID-19 Vaccination Center. So they worked with the public health officials in Los Angeles County to bring a vaccination team, set up a center at their transit hub, and then told all their customers, you can take the bus here and you can get your vaccine and then go on wherever else you're going, to the store, to the work, to, as you need to travel, you can get your vaccination on the way. That's very good for convenience. That's a great way to link people's use of transit with ease in getting the vaccine by putting it right. You're making it so easy for them. They don't have to go somewhere special to get the vaccine. They just have to get on transit as they usually would to go where they need to go and get their vaccination on the way. And the third way to provide access to the vaccine via transit is to provide free rides to transit. And this is something that is growing around the US. I'm now seeing instances in Canada. I've seen it's beginning to start in the UK. And the idea is quite simply that transit agencies waive the fares for people who are going to get their vaccine. And there are a couple of ways to do this. One is some transit agencies are telling customers, when you board the bus or train, show your vaccination appointment, a printout or on your phone, show that to the driver when you get on the bus. And the instructions to the driver, if somebody shows their vaccination appointment, it has the date on their appointment matches the date, they ride for free and they get their vaccine. The other way some transit agencies are doing it is they're handing out tickets or passes. The Greater Cleveland Regional Transit Authority is giving out day passes. So when people register to get their vaccine, as part of that process, they get a day pass that they can use the day of their vaccine to go get vaccinated. They can also use it for other things too. It's a great way to introduce people to transit who haven't previously used transit. And in fact, we're seeing some examples of that. The Greater Dayton Regional Transit Authority, also in the Midwest in Ohio, uh, they've seen that of the people who've signed up in the first weeks of offering free rides to the vaccine, the majority of people who've signed up, as they've surveyed people, are people who never used transit before. So Vax Transit, as I call it, access to the vaccine via transit, is a way to attract new customers to transit. It's a way to build awareness among people who may not have used transit before, that it's available to them, and it's something that can improve their lives. And a free ride to get the vaccine is a very simple, powerful way to do that. And that leads me to the fourth and last important element of Vax Transit, and that is mobile vaccination clinics. It is using transit to move public health teams, vaccination teams, out into the community. We're beginning to see more and more examples of that as well. In Jacksonville, Florida, the transit agency there, the Jacksonville Transit Authority, or JTA, has outfitted some of its buses as mobile vaccination clinics, and they're being driven by transit drivers. They're bringing public health teams out to different neighborhoods in the city of Jacksonville, which is Florida's largest city, to make sure that people in those communities can get vaccinated. And that's especially important for people in communities that are especially vulnerable, people who have other medical issues that might make them more at higher risk of getting COVID-19 or of having a severe case of COVID-19, and people who might have other challenges, particularly mobility challenges. Bringing a vaccine team out into the community, so that essentially bringing the vaccine to their doorstep or as close as possible, is another important thing. And where transit is so valuable in this is transit systems know their communities. They're built to connect communities. So the bus drivers who drive a route through a neighborhood every day and know that neighborhood are really the ideal people to help a public health team get to that neighborhood and know all the places they need to stop to make sure they reach people, because those bus drivers know the area and they know the people in community. And that also can help with instances where people might feel hesitancy to get the vaccine. If somebody you know and trust has gotten it, we often hear the message that if doctors are telling people when they get the vaccine, that is important for people to hear. It can also be important to hear it from somebody you know, like your bus driver, somebody who you see on a regular basis. You may trust that person. And if you hear that they got the vaccine and they feel better about having it, that can make you more likely to get it as well. And although that issue of vaccine hesitancy is something that has been talked about in some news stories, I do want to make the point that hesitancy is not the biggest challenge with people getting the vaccine. Access is the biggest challenge. Um, there were some news stories early on in the rollout of the vaccine in the U.S. here in America, um, making the assumption that Black Americans were hesitant to get the vaccine, and that's why vaccination rates were lower for Black Americans. And the Kaiser Family Foundation surveyed Black Americans, and a couple of other groups surveyed Black Americans, and came back with very clear data that shows that Black Americans were not at all hesitant to get the vaccine. The access was the issue. People in communities, in largely Black communities, were saying, I see the mass vaccination sites are being set up, but they're being set up in a neighborhood that I can't easily reach, or in a neighborhood that would require me to drive to a drive-in only vaccination site, and I don't drive a car. That's not hesitancy, that's access. You've got to make sure people are able to access the vaccine in a way that doesn't require more effort from one group than from another. And that's where all of these steps to incorporate public transit into the process of vaccination are so important. And the last thing I want to close with is a thought on what this means for the future. This is obviously, of course, very important right now. Getting as many people vaccinated against COVID-19 is the clearest way to move on from the pandemic, to move on from this year in which we've lived with lockdowns and the need to stay socially distant, physically distant from each other to protect everyone, the fastest way to move on from that and to be able to move into a new normal where we can be around each other more is to get vaccinated against COVID-19. But the idea of using transit to connect people to public health and particularly vaccination doesn't end when we get everyone vaccinated against COVID-19, because the other thing we're seeing in the looking at the data around health in general is this season has been the lowest on record for the flu, the influenza, the flu that we think of, that people get every so often, that we think of as kind of a normal, if I can use that word, part of daily life, something that comes up every winter. You might get the flu, get your flu vaccine. The numbers for the flu this year are lower than they have ever been. The U.S. Centers for Disease Control, CDC, uh, for the 2020 to 2021 flu season, for this flu season, the numbers of people that have been hospitalized for the flu are 1/3 lower. I'm sorry, they're 1/3 of the numbers that were seen in the previously lowest season, which was in 2011. So the lowest season for the flu 10 years ago, this year, we're only 1/3 of that number. That's how much wearing masks, practicing physical distancing, all of these things that we've done to protect against COVID have also driven down the flu. And what that means for transit going forward is all the work that transit agencies do to help people get the COVID-19 vaccine today, they can reuse every year, every flu season, to help make sure people are getting their flu vaccines and keeping communities safe in that way. So there's an element of this that makes a difference today, and there's an element of this that then can become a permanent improvement, a permanent change in the way that transit agencies help connect their communities and protect us all going forward. And with that, I'd love to take your questions and help in any way that I can for any of you out there who are thinking about how you can make this idea happen in your communities. Thank you very much.
Thank you very much, Stuart. There is already one question, but for all the other guests, feel free to type in your questions right now in the chat Zuschauer. And we will start with the question from Leonie. She says, thank you for the interesting input. She has two questions. First, what is your thought on free transit in general? And especially on this specific lecture now, what are arguments from people against your concept? So are there people arguing against this?
Those are very good questions. So to start with the first one, free transit in general, that's a question that I think every community, every transit system has to answer for themselves and has to look at a set of different factors. What I have seen in looking and working with transit systems of different sizes in different cities and different areas is the answer really is it varies. So, for example, there's a transit system in the Midwest, in Ohio, that went to free transit. They made their transit free because of COVID, and then they decided to continue with free transit and make it permanent. And part of their decision in doing that was they're in a town in Southeast Ohio. The largest customer, so to speak, or partner of their transit system is the local university. And the university already essentially paid for about 1/3 of their service because they provided bus service to the university campus and into town. So they had conversations with the university and decided that the university would up its financial contribution to the system, and they would just make the transit system free permanently. They would just extend the sort of making it free during COVID into let's make it free permanently. That's something that some other cities are talking about doing. Kansas City in Missouri is looking at that same thing. They have talked about making their transit system free, and that's been largely led by the mayor of the city working with the transit system. And their argument is that they want to replace essentially the portion of the transit agency's budget that comes from fares with budget that is that's supplied by the city. Essentially, the city would increase its subsidy of the transit system, and then enables everyone to have free transit. And what I find so interesting about these examples, these approaches, and these are just two, but there are a lot of others where people are thinking in similar ways. Um, to me, the question of free transit is really, I find that when I have this discussion with agencies, well, it'll come up initially as free transit, and one of the things I talk about with them is to frame it as zero fare transit, because what it conveys is sometimes people think free transit, they think, oh, well, where's the money going to come from for it to be free? Well, the money's coming from somewhere. In a lot of cases, you're paying for the transit through your taxes. And I think that by emphasizing that part of the message to people, it's a great way to say this is a public service you pay for that you directly benefit from. It's a very good use of your taxes. And by framing it that way, it changes the conversation and it makes people more open to the idea that, well, if a little bit more of the budget for my taxes goes into the system and I don't then have to pay a fare, and that makes it easier for other people who might be at, at an economic disadvantage to me to have a better opportunity, I support that. So that conversation is the kind of conversation that I think more transit agencies are having and will have. And this past year with COVID plays a big role in that, because many transit systems went to the suspended fare collection, essentially went to free transit for at least part of 2020 out of necessity to protect public health. They didn't want to have customers walking by the driver and potentially risking that a driver's coming in contact with all these customers and at risk of COVID. And it's also to protect from other customers. If you have a cluster of people at the door of a bus waiting to pay, you have the risk that people are close to each other and the virus could spread. So we've essentially had this sort of massive experiment with lots of transit agencies seeing what it's like to have free transit. And what I mean by that, they're able to look at the logistics of that. Does that make bus boarding faster? Does that make buses able to run more on time if you're cutting out the amount of time that they're dwelling at the stop while people pay their fares? And then of course you have to balance that with, on the other side, you no longer have that revenue in the budget, but it creates a conversation where you can say, look at the improvements to customer experience. The buses are running more on time. People are getting to where they need to go faster. How can we keep that up? Can we keep that up by finding money elsewhere in city budgets, state budgets, federal budgets that can supply that? That to me is the way to have the conversation. And sort of, because sometimes what happens when it comes up as free transit is people will argue, oh, well, we can't do it free. That wouldn't work. If you make it about, well, we improved the experience with all these things. Now, how do we replace the revenue with something else that enables us to continue this? That discussion is one that is less controversial and gets us to the same goal. And then to the second question on are there criticisms or opposition to this? The biggest thing I've encountered is not so much opposition in the sense of people saying, I don't want to do that, or that seems like a bad idea. The issue that I've encountered with a few agencies is there are some agencies who, by the sort of legal structure that governs them, are not able to provide free service. I'm working with one agency that its bylaws do not permit it to offer any kind of free service. So they want to offer free transit to the vaccines, but their operating legal structure doesn't allow them to. And I'm working with them right now to see if we can find a way to see if we can find a funding source that could do this temporarily, maybe philanthropic, maybe it's a partnership with a public health department, something like that. And so what that raises for me is this issue that, to go back to the first question, if we're going to change the structure of transit, make it more accessible, and if that means eliminating fares, some agencies are going to have to change their structures to permit that. They're going to have to find these things that are obstacles to doing that and eliminate them, because they can get in the way even when there's a strong desire to do something. So it's not an impossible thing to solve. It's just something that we have to find, identify that it's an obstacle, and then get people to see the problem and fix it.
Thank you very much. There are no questions right now in the chat. We can wait a little bit longer. And in the meantime, maybe I just go with my question.
Sure.
I'm not quite sure, but maybe I think most of the people listening and watching here are probably from Germany. And I can imagine that they had the same questions in the beginning to this topic, because I was wondering, you said like in the US, the biggest problem right now is to get to um, make access to the vaccine in general to all people. And I think in Germany, the problem right now is more of to get enough vaccine into the country, but not to get it to the people. You know, where the yeah. And do you think, while the US is a huge and country with a lot of rural areas also. So, are you more talking about like the city structures to get like the vaccine in the cities to the people and communities and neighborhoods, or is it also something in the rural areas?
It's in both. In fact,
Both.
the transit systems that were among the earliest to adopt this Vax Transit program that I'm advocating for were small rural transit systems. And one of the reasons I've asked transit systems as they've adopted this, what's the factor, what's in your decision making? Why are you doing this? Even though I'm the chief advocate for it, I'm asking them, why are you doing it? Because I want to make sure I understand that so I can help others with it. And for the small rural systems, the answer is many of them charge very, very small fares. In some cases, they charge $1.50. It's a very small amount, um, and and their goal is really not the fare revenue is such a small part of their budget that it was an easy decision for them to say, we can suspend the fares. Yeah, we'll have to figure out the money later, but we might be only talking about 5% of our budget. So it's a quick decision to say we'll do this. And also, the rural transit systems, I think, have a little bit more flexibility in um, kind of how they serve their areas, um, and they're kind of looking at these areas where people are very, without being able to have an access to the vaccine in a rural area, be able to have or transit access to the vaccine. There are people who might have to travel hours to get the vaccine. So if somebody can bring the vaccine in, the transit system can help bring the vaccine in and then help people get to a local community center. Um, that's a role they can play, and it's something that I think in those smaller communities where their budget on fares fares are such a small part of their budget, it's less of a consideration for them than a big urban transit system that has, say, 50% of their budget comes from fares. And also, it's a little bit more challenging for bigger systems that have, like think of subway systems where you have to go through fare gates to use them. If you're a bus system and all you have to do is put out policy guidance to your drivers and say, if somebody shows an appointment confirmation and the date on it matches today's date, let them ride free and track how many people are riding so that we can see how many people are using the service. That's relatively quick to implement. It's really a matter of communication and training. If you're a big urban transit system and people pay, and they have to go through fare gates, you've got to give people a way to get through the fare gate to have free transit. And transit systems are taking different approaches with that. The one I mentioned in Cleveland, they have fare gates and they're handing out day passes. And the day pass is an elegant solution because they have a subway system that uses fare gates, they have light rail systems that are proof of payment, and then they have buses where you pay at the fare box when you get on. The day pass covers all three of those. You show your day pass to the driver, you have it on hand in case spare inspector checks you on proof of payment, and you dip it in the fare gate for the subway. So, but that takes a little more time to roll out. You've got to get those free passes in their case, they supplied the free passes to the county and city Department of Health so that when people register for the vaccine, they get the day pass. That's also another consideration. It actually makes more sense the way Cleveland did it for the health department to hand out the passes than the transit agency, because think from the customer perspective. If I have to go to the Department of Health and register for my vaccine, and then I have to go contact the transit agency and get my free fare pass, that's two things I have to do with two different agencies. If I go to the health department and register and they say, great, you're registered, here's your confirmation, and here's your pass for transit, I'm done. I'm happy. So that can take a little bit more time to make those things happen. Um, but those are important and those are the kinds of things that when you're in the situation you described for Germany, where the bigger logistical issue right now is getting enough vaccine in the country, now is actually the perfect time for the transit agencies to be doing this coordination with the health authorities and getting ready so that when the vaccine availability ramps up, the supplies come in, they're ready to they're ready to make sure that people can quickly get it.
Thank you. There is a comment that is, I think, fits perfectly to what we just started to discuss. Mr. Dietrich says, thanks for the input. The situation in Germany is currently different as availability of vaccination is the big problem, the big issue right now.
Mhm.
There's even a strict prioritization. Once this problem is solved, access will most likely not be the major barrier in Germany, but indeed hesitancy. He gives a number about 20% of the population. Nevertheless, the idea of mobile vaccination clinics could be very interesting for Germany as well. This goes beyond COVID-19. Medical teams should regularly come to communities, people's homes, like it is done in other countries, just as in Cuba. So that is more as a comment than a question.
It's a very good point, and I think what he's Mr. Dietrich is saying there is um, very much the same as my fourth point in the Vax Transit, which is the transit systems are the perfect conveyance, the perfect vehicle to get the vaccination teams out into the communities. So, and that's every community, every country will face this challenge a little bit differently, and I think in some ways this Vax Transit, this use of transit to get people access to the vaccine in the U.S., I think has grown so quickly and has been such a pivotal thing for this country, partly because our transit. It goes back to what I said in the beginning. Our transit infrastructure and our approach to transit has been behind countries like Germany and other parts of the world for some years, and I think that it's required a push to get transit involved, and I think it's important because I think that push to get transit involved, at least in my view, I'm very much hoping this is going to happen, and I'm going to push for it to happen, creates the environment where we say, okay, look what transit was able to do to get people healthy, to get people protected. Now let's use that as an opportunity to say to, especially to the federal government right now, let's really invest in transit like never before. Look what it did to help us get out of the pandemic. Think what it can do for everything else, for access to jobs, to communities, to social well-being, all those things. So, but for countries, for communities, for cities where transit infrastructure is much better and that's less of an issue, parts of the parts of the project, like mobile vaccination teams, are going to be the bigger. They're kind of going to be the bigger piece of it. So, it may well be that in German cities, German communities, towns of maybe of all sizes, using transit systems to move vaccination teams will actually be more important than setting up a free transit scheme, because people may already be so comfortable using transit, they may already have monthly passes, they may just it's there, you don't have to shift them out of cars as much as maybe we've had to shift people out of cars. So that's where using the vaccination teams could be really the bigger piece of it. And that's part of why I have this approach where there's four key things, and I don't call them four steps that you have to go from in sequence from one to four. They kind of, it's a different combination that works in different communities.
Thank you. Lynn says, our initiative Einfach Einsteigen here in Bremen tries to bring through free transit in Bremen with dividing the payment between the people here and companies. Many say that they don't want to pay because they do not use it at all and find it kind of unfair to pay for something they don't use. What do you think about that?
You may not use transit, but many of the people that make your life possible use transit. And that to me is the message that I send to people who question whether they should pay for transit, even if they don't use it. Here's the analogy you could use. You go to school when you're a kid, but you pay taxes that support the schools all your life. That's a good thing, because you're paying to make sure that other people have the same opportunity for education that you had in the years of your life when you needed to get educated to have opportunities for, good life and job and career and all those things. Think of transit the same way. Even if you might not ride it every day, if you're supporting it, people who need to get to the doctor's office, the bake shop, the supermarket, the offices where you need to go to get maybe the post office, many of these people will use transit even if you don't. So if you're supporting transit, you're benefiting from that. The other thing, and this is often used as kind of part of the argument in the US, is transit reduces congestion. So the more people that use transit, the less traffic congestion there is. That's certainly part of the argument. I think that argument sometimes gets overused because, and it's not a bad argument, but the reason why I sort of make it a secondary thing is it really only works. The congestion argument really only is applicable during the sort of peak times of the day when lots of people are traveling to and from work, when the highways are busiest. And so sometimes people poke holes in that argument and say, well, okay, but it's only congested some of the day, so maybe I should only pay a little bit. To me, the more important argument is the argument that even if you don't use it, many of the people that your life touches in some way or another use it, and therefore you're supporting them. That's all hours of the day and night, because the person who has to get to the bakery at 3 in the morning to make the bread so you can get fresh bread and nice coffee in the morning likely uses transit to get there. And the person who picks up your trash in the middle of the night while you're sleeping likely takes transit to get to their job, and they are probably taking transit at 7 or 8 or 9 o'clock in the evening to get to a job where they're going to be working overnight. So that's my message on that.
There's a thank you for your lecture from Caroline, but without a following question.
Well, I thank
Um,
Caroline for attending the lecture. I hope it was helpful.
Yeah. We can give it some more time because sometimes I think people are taking some time or need some time to type in questions. So if you have other thoughts or questions to our guests.
Sure. Well, I have one kind of a thought and question for you, which is, um, how is the? I'm trying to follow the kind of what's happening in different countries with the vaccine. So, is the issue for Germany right now? It's largely that is it about manufacturing enough, importing them? Kind of what's the limitation in terms of the logistics of getting more vaccine right now?
Yeah, that mainly is the problem to get enough vaccine into the country. And
Mm-hmm.
then we have this program with different steps when you are allowed to get the vaccination. So there are
Mm-hmm.
certain groups of people which it also, you mentioned this point that it would make sense to vaccine the transit workers first. That is part of like how it works in Germany too. There are these different groups where it depends how old you are and where you work on if you are in the beginning to get a vaccination or in the end.
Mm-hmm.
But right now we're still in the first group, so the oldest people and healthcare workers and so on. So we haven't. Oh no, that's not true. There are some areas that have already reached the second group,
Mm-hmm.
but it's quite slowly at the moment. Um, there's another question coming in from Maya. Have I answered that a little bit?
That was helpful. Yes.
Okay.
Thank you.
Okay. Maya says the problem you presented is obviously mainly American, where many vaccination spots are hardly reachable without a car. What are your thoughts on improving vaccination in countries where many people can already reach the vaccination spot? Do you have an idea how to improve the vaccination process anyway? Maybe also something to do with transit?
One thing that I think is I'm seeing a lot of is even for people who are able to get to vaccinations, um, I worry that we're over reliant on technology. In other words, where we want people to go online and register to get their vaccines before they go to a vaccine site. That presents a challenge for people who may not be comfortable using the internet, may not have a good internet connection. And here in the US, in Philadelphia, the city has struggled in the recent weeks with uh, its vaccination, initially with the rollout of the vaccination sites, and then with this issue of equity, with some people having better access than others. And one thing they tried is they eliminated online registration and instead said, if you're in this particular zip code or postcode, come to this vaccination site anytime you want on these days and you'll get your vaccine. And then they said for some other zip codes now, for these zip codes, postcodes, these are your days to come, just come anytime. That you don't have to register, just come down. And by doing that, they just did this last week. They've already seen an improvement in the people from those particular postcodes, those areas getting vaccinated. They essentially took the areas where they were seeing the lowest rate of vaccination and said, you get a day that's all for you. Only you in this area can come and drop in. And by doing that, it helped reduce the risk of people waiting in long lines, because if they're saying just this neighborhood comes, there's a limited amount of people that are going to come. And by saying drop in any time, it's the simplest possible message to people: just come when you can and you get your vaccination. Those are the important things, I think, like that, to be thinking about, because if it's easy to get to transportation, to get to the vaccine on transit, that's one thing. But if somebody can't figure out how to register for the vaccine online, then transit's not even going to be a factor, because they're going to be stuck at feeling like, I don't know how to even go and get my vaccine. So we have to make sure that that isn't an obstacle. We have to eliminate that obstacle. Um, the other one, and this is a little more specific to transit, but it's also a general one that could apply, is um, transit agencies and public health agencies, everybody who's involved in distribution of the vaccine, needs to talk to each other. And that might seem like a very simple piece of advice to give, but here's an example of where it can break down. Some transit agencies require people to book an appointment in advance if they need, but this is particularly for people who live with disabilities, who might need what we call in the US paratransit, so someone to come and give them a ride with accommodations. The agencies that are offering that for free are telling people, a lot of them are saying you've got to book one day in advance. Understandably, they need to know how many people are booking so they can make sure they have enough drivers and vehicles to take them. But if the transit agency says you have to book your ride in advance, and the vaccination site says, well, we have same day appointments, you can come today, that person's not going to be able to get they might be able to book a vaccination for today, but they won't get there. And so that's where I've worked with some agencies in this situation. And one of the things I've really worked with them on is, you have to talk to each other, and you have to check each other's messages before they go out to the public, and make sure that what your counterpart agency is saying works for you, and vice versa. So if the vaccination site offers same day appointments, great. But if people are going to need a free ride, make sure that everybody who's putting that message out is saying, if you need a ride and you have to book it a day in advance, book your vaccine appointment and ride on the same day, so you're not hitting that limitation. So that's the kind of thing where it's, we often say these kinds of pieces of advice, like everybody needs to work together and talk together. Yes. But being able to show examples of, if you don't do it, here's where things could break down. Here are the things to pay attention to. That's why it matters so much to do that.
Thank you. There are no more questions right now. We can also wait a little bit longer. I actually really also like the idea of that you emphasize of transit that as a tool to connect neighborhoods and form communities, and also transit as a tool to because you said, like, to get vaccinated is also a big question of equity, so that there are these specific parts where people, although they really want to get vaccinated, so it's not a question of wanting or not, but they just don't get the vaccination. So transit can become the tool to make this more equal. So I really like that idea.
You're exactly right. And that's why I think it's so important to do this now, because it's part of the way out of the pandemic, but it's also so important. I've had people, and I bring that point up in the presentation, because that's a question I've been asked by transit agencies. Okay, so we'll get people to the vaccine now, but what do we do with this when it's done? Well, don't throw it away. This can become a new part of your service. That's something you do every year, because the flu doesn't go away. The flu is something we deal with every year. We're all advised to get a flu vaccine. And we also don't know yet what the future looks like with COVID. It might be that we all get a flu vaccine and a COVID vaccine every year, or every 2 years, or on some frequency. And we won't know the answer to that question, for a while, because that's something the scientists are studying now. And I think they'll need to get people vaccinated and then be able to do studies. I know there's some companies that are doing this now, some universities. They're looking at the COVID vaccine the same way they look at the flu vaccine, and saying, okay, once you're vaccinated, are you protected for good, or does it wear off after a year or 6 months or some period, and will you need it on an ongoing basis? So that's another reason why thinking of this as a long-term thing is important, because we very well could be living in a world where we get a COVID vaccine every year, the same way we get a flu vaccine.
And do you think the challenge is more with the transit agencies, for example, to talk with them about the concepts of free transit, or is the challenge more with the people? Because you said in the US it's not like public transport is not as frequently used as the use of your own car, especially in COVID times where people still think it's dangerous to go on public transport because you can get infected there.
I think the conversation is with everyone. With transit agencies, it's a shift in mindset from thinking about, and this is this may sound like a very American answer, and I'm curious if you think this applies to what degree it might apply in Germany. One of the challenges, I think, for a lot of transit agencies in America is there's a large amount of thinking about transit as a commute tool. It's to get to work and home. And I think that that is starting to change for the better. People are starting to think about transit as more than just a way to get to work and home. And as part of something that you build your life around, being able to live in a place where transit is your main mode of mobility and you don't need to own a car. And that's that. This is where vaccine access, to me, is such a great thing to be doing, because it's. I've talked with transit agency executives who've told me they've never thought about a use of transit that is so different from commuting more than they have in the past few months thinking about vaccine access. And I think that's great, because I could be critical and say, well, gee, why weren't they thinking of this before? But that's not going to get us anywhere. What's going to get us somewhere now is, okay, I've got your attention now. You're thinking differently. Now let me work with you to really let's see how we can build this change into a larger way of thinking differently about how you provide transit. And in doing so, you're going to, I say this to transit agency leaders a lot. You're probably worried a lot about your budget right now because you've lost riders that were taking transit every day to go to work. I'm bringing you something that, if you think about it right, is going to refill your budget, and hopefully refill your budget more than just providing commute services ever did. Because if you're getting people comfortable with the idea that they can take transit to do lots of things, go to the store, go to the doctor, go out to dinner, they're using transit more than they did when they were riding twice a day, 5 days a week. And that's and part of my message to transit leaders is you have to be willing to rethink your service to do that. If you run service every 10 minutes between 7 to 9 a.m. and 4 to 6 p.m. and then you run hourly service the other times of the day, you've got to change that. And now actually you have the flexibility to change that, because if people aren't going to work as much as they were before, commuting to work 5 days a week, you can change your schedule now and say, we don't need to run every 10-minute service between 4 to 6 p.m. We're going to run every 15-minute service from noon to 9 p.m., for instance. So they have flexibility to change, and that change is what's going to get people to be able to really think even more about using transit beyond just going to work.
Well, I think that's not only an American way to look at it, because I think many of these questions or challenges are ones that with the public transport or the transit agencies are ones that we also look at in Germany. And that's also why this Öfikon, the conference, is taking place, to change or open mindsets about public transport and see it more on an environmental aspect, or as you said, as a transportation for health issues, to open up that mindset and get new ideas. Yeah. So there are no more questions coming in. Stuart, if you want to finish with some last thoughts or questions, feel free.
Sure. I will finish with just a couple of things. One, I will make available for anybody who'd like it. I have some slides I can share that, if they're helpful to anybody in the audience, if you want to make the case to a transit agency, if you work in a transit agency or you work for an advocacy organization and you want to make this case, I will share a slide deck with you that you can use to help make this case. It's one that I use when I'm talking to agencies. You can also visit my website, stuartmader.com/VaxTransit, VaxTransit. And you'll see a list of agencies. There are more than 400 agencies now in the US. There are 9 agencies in Canada, and there are 5 agencies, I think 4 or 5 agencies in the UK that are now offering free rides. And I update that list just about every day. I hear from new agencies that are doing this. So, and if anyone in the audience is aware of agencies in Germany that are doing this, I would love to add Germany to the list. So please feel free to get in touch with me. My email is Stewart, STEWART, at stewartmader.com, STEWARTMADER.com. And with that, I wish everybody, I thank everybody for coming to the lecture, and I wish all of you good health.
Thank you very much. I wish that to you too. Thank you that you came to this conference, to this lecture, and presented us with these really interesting and future-looking ideas.
Thank you so
I
much.
hope you have a good day. Thank you.
You too.
Goodbye.
Bye.